Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before turning to today's numbers, I would like to answer a few questions that I've heard recently. There is some confusion about what is allowed to take place under the category of outdoor recreation. First, I've been allowed whether shinny or hockey is allowed outside, even if it's 4-on-4. The answer is no. Any outdoor activity where individuals come within 2 meters of each other is not allowed. Skating or other outdoor activities can continue with up to 10 people, but all members of different households must stay at least 2 meters apart the whole time. We will be updating our website under Sport and Physical Activities to address these questions, and we'll be having discussions with law enforcement to ensure that the rules are clear. Another question is whether individuals who have tested positive and gone into isolation need to be retested and get a negative result before returning to work or normal activities. Again, the answer is no. If you test positive and isolate for the required mandatory period, there is no need to be tested again. Evidence is clear that unless an individual has an immune-compromising condition, they are not infectious to others after 10 days have passed from the start of their symptoms, as long as their symptoms have resolved. Retesting someone within 90 days of a positive test is not effective or appropriate unless this test is ordered by their doctor. It is also not an effective use of our lab teams, who could be spending their time and energy testing people who have COVID symptoms or who are linked to an outbreak or who are a close contact of a confirmed case. For employers seeking clarity around when staff can return to work, AHS does provide a text message to anyone who tests positive at the point in time when their isolation period is over and it is safe for them to get back to work. On a related point, I also want to remind employers whose staff have tested positive or who are a close contact of a case that these staff are legally required to isolate at home until their isolation or quarantine period has ended. They should not be pressured to return to work before this time, as this puts everyone in the workplace at risk. Turning to today's case numbers. Over the last 24 hours, we have identified 1,240 new cases of COVID-19 in Alberta and completed about 18,300 tests. This means our positivity rate currently stands at about 6.8%. There are currently active alerts or outbreaks in 448 schools, or about 19% of all schools in the province. Currently, these schools have a combined total of 1,992 cases. There are 795 people in hospital, including 151 who have been admitted to the ICU. Sadly, 9 new deaths were reported to us in the last 24 hours. My thoughts are with all those mourning the loss of a family member or friend, whether it is from COVID-19 or any other cause. Today, I want to update you on a development that was first referenced last week. As you likely know, this weekend, the federal government restricted all incoming flights from the United Kingdom for 72 hours. This is in response to a genetic variant of the virus that causes COVID-19, which is currently circulating in the UK. At this time, this variant appears to be more easily transmitted from person to person, meaning it can possibly spread more widely in an exposed group of people. While this is not fully confirmed, there is sufficient evidence to prompt action on this development. It is important to know that at this time, the variant does not appear to cause more severe symptoms. It does not impact how the body responds to the virus, the lab testing performance, or the effectiveness of the COVID-19 vaccines. The Public Health Agency of Canada is monitoring the situation closely. They are working with various international partners, including the World Health Organization, to better understand this variant and its impacts, and to do ongoing assessment regarding interactions between the vaccine, lab tests, and this variant. So far, no variants with the same set of mutations have been identified in Canada. The measures we already have in place to limit the spread of COVID-19 work against this variant as well. It is not uncommon for new strains of viruses to emerge from time to time. However, we are taking this seriously. That's why we are asking any travelers who arrived from the United Kingdom within the past 14 days to immediately get tested for COVID-19 if they have not already done so. This is recommended even if these travelers do not have symptoms. Alberta Health Services will be contacting all travelers in this category and offering testing appointments. As a reminder, quarantine is required for 14 days after arrival from anywhere outside Canada, unless individuals are participating in our border pilot project. However, any travelers from the UK in the last 14 days who are participating in the border pilot must also immediately quarantine at this time, even if they have had a negative test. As always, I would ask that all Albertans show kindness and support for anyone who's returned from the UK or who is impacted by this call for testing. These individuals have done nothing wrong. Getting tested does not mean that they are automatically at risk. We are being cautious to help protect our community's health. This new strain is yet another reminder that we cannot let our guard down with COVID-19. This is a challenging and evolving virus, and it can and will spread quickly if given the chance. After this weekend, we have now diagnosed more than 91,000 cases of COVID-19 in our province. The R value for the last 7 days is 0.92 in Alberta. This includes an R value of 0.89 in Edmonton Zone and 0.97 in Calgary Zone. The positive signs that I mentioned on Friday have continued through the weekend, but our situation is still serious. Our new case numbers are still extremely high, and our healthcare system remains under severe strain. This week, we must redouble our efforts and celebrate this early trend downwards by continuing the actions that will eventually bring our hospitalization and ICU numbers low enough to support access to the system for all healthcare needs. We have lived with this virus for 10 months. We know how it spreads, and we know that it is critical that we all reduce the spread as quickly as possible. This week is another test for our province. This is usually a time for many to relax and celebrate, but we must not relax our guard or gather with friends and family outside our households. We know that celebrations can quickly turn to outbreaks if we fail to take the right precautions. I know it is difficult, but our connections of love and caring for family and friends are as strong apart as they are together. We are all in this together, and this week, that matters more than ever. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you please put through the first caller?
The first question is from Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. We've heard anecdotally that many people plan to ignore public health rules and gather with loved ones both outdoors and indoors this Christmas. If neighbors see neighbors doing this, should they call law enforcement and AHS? And do you believe tickets should be given?
It's disappointing to hear that people are planning to violate the public health orders, and I think it unfortunately shows that not everyone understands the seriousness of COVID-19 and how quickly it can spread. With respect to what I would recommend for how neighbors would treat each other, I think that considering what would you want your neighbor to do for you if something like that was happening, and considering what the impacts of those gatherings could be on our community. And I think that there's other times where we may observe something happening that we don't think is in the best interests of our community, and I think it's always ideal if we have a good relationship with our neighbors to try to understand why and what's happening. It could be that there's some explanation of what the particular occurrence is happening that you may not have thought of. And so I think not jumping to the first conclusion that people are deliberately violating the protocol. But ultimately, again, I think having people remind each other that these protocols are in place for all of our protection, and making sure that people are aware that this is something that we have to take seriously, because ultimately we can only get our hospital and ICU beds freed up to care for other Albertans' health needs beyond COVID-19 if we all work together.
Operator, could you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. We received information that the Red Cross is setting up equipment in the field hospital mobile medical unit inside the Butterdome next week. So have staff been assigned to the Butterdome yet? And how soon may patients be admitted, or what timeline are you looking at?
Details of the planning for the additional space would best be provided by Alberta Health Services. With respect to timeline or when it might be utilized, I will repeat what I've often said, which is that that's in our hands. And with respect to the demand for those beds, that relies entirely on our efforts to bring the curve down. We're very close today to almost 800 people in hospital across the province. And if we do not collectively bend the curve down, we may need those extra spaces. So really it is all in our hands. If we can continue to work together to bend the curve as we have been, again, some encouraging early signs, then perhaps we won't need those beds at all. That would be the best case scenario. But of course, it's also prudent to make sure that they're there in backup just in case they're needed. But it really is up to all of us.
Operator, can you please put through the next question?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. Another question about this COVID variant. When you say that there's been no cases detected, would the testing in place now identify those types of cases, or has it been added to the process? And how likely do you think that the variant has already arrived in Alberta, just given the travel that's still been going on?
The testing that's done in Alberta involves some genetic analysis of a sample of the viruses that are detected. So, of course, and that's true across the country, there's always a small possibility that there could have been an introduction. But again, we haven't seen any evidence that particular combination of mutations has been introduced into not just Alberta, but into Canada. Of course, we will be watching closely and doing some additional work to assess samples to see if we can identify it. But at this point, again, there's no evidence that it has arrived.
Operator, can you put through the next question, please?
Next is Bill Fortier with CTV News. Go ahead, Bill.
Hi, Dr. Hinshaw. The Oilers have said they're confident they will be playing the season starting January 13th in Edmonton. Looking for some clarification from you on what the province's official or AHS official position is at this point on NHL hockey next month in Edmonton and Calgary.
I've been having conversations with my colleagues across the country, as this isn't just an Alberta decision. Of course, the decision involves all those locations that have NHL teams. And so the critical piece is that we're able to find a path forward that ensures that public health is protected, and that's the work that we're in right now.
Operator, can you put through the next question, please?
Next is Paige Parsons with CBC. Go ahead, Paige.
Hi there, Dr. Hinshaw. AHS put an order on a church in Edmonton last week after inspectors found a number of issues with not following rules about capacity, distancing, or masking. And also last week, a pastor at the same church's La Crete location gave a sermon that's posted online counseling his congregation against following public health rules. He called the restrictions tyranny and said they should carry on with their worship come what may. What can the province do if churches refuse to follow public guidelines, regardless of what enforcement might be used? And how do you reach people whose faith leaders are giving them these messages?
We have tried for many months. We have worked very hard to work collaboratively with faith leaders in Alberta, and I will say that the majority of faith leaders have been incredibly hardworking, have been demonstrating leadership in caring for their communities and in making sure that their communities have accurate information. I think that we have opportunities to continue to engage and build that relationship and try to continue to build bridges, but ultimately when any group is putting their communities at risk, we of course start with education. We start with offering support. That's always how the public health teams begin engagement. But if groups continue to make decisions that put their communities at risk, not just those who may attend those services or who attend a particular event or gathering, but those actions put their broader community at risk, then unfortunately sometimes it does need to move into an enforcement category. And what I would say, I guess, is that in my opinion, COVID-19 has given us an opportunity to make choices about how we care for each other, and the measures in place right now are the best way to care for our neighbors and for our communities.
Operator, could you put through the next caller, please?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my question, Dr. Hinshaw. I'm wondering if you've seen evidence that CERB payments are fueling the overdose crisis in Alberta.
My understanding is that this is not unique to a CERB payment. You know, I understand that the cycle of timing of when certain overdoses happen sometimes is linked to the provision of different kinds of income supports. But I think that it's really important to separate out the necessity of providing support to all those who are impacted by the pandemic, particularly those who are ill and need to isolate, or those who are close contacts and need to quarantine. And that's essential for us to be able to continue to keep our pandemic response going and to minimize the spread of COVID-19. And the issues of substance use disorder and individuals who are experiencing challenges with substances, and making sure that those individuals have access to that full spectrum of services that they need. So I think, again, it's important to look at that broader picture and make sure that our work focuses on the supports and services that are available to those who are struggling with those issues.
Operator, could you put through the next question, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hey, Dr. Hinshaw. I know that you've spoken about this a little bit before, but I was just looking to get clarification on who made the decision that paramedics would not be allowed or not be part of the first phase of the vaccine rollout, and have there been any decisions made about phase 2 at this point? Thanks.
It's really important to know that the decisions about the first phase of vaccine were focused on individuals who were at the highest risk of severe outcomes, those who were in close contact with those individuals, and the groups within the healthcare system where there is critical pressures. And again, those identifications of those groups were part of a discussion that involved, again, those risks of exposure, the risks of the worker shortages, and the combination of risks of introduction as well into the locations where those people work. So it's not, I think that sometimes people understand the decisions as having, as you referenced, taking people off a list, and that is not how it was done. There are many, many people who provide incredibly valuable services who are not part of that first phase simply because it, again, is focusing on those at that highest risk and those immediately around them. The decisions about phase 2 have not yet been made. In fact, those will not be made until early next year, because we do need to look at that broad scope of factors and consider how we're going to best look at the ethical dimensions of allocating a scarce resource, risk factors for severe outcomes, and some of those other considerations that I mentioned earlier. But I want to reiterate that people who provide critical services that's not the only category for receipt of the vaccine. And so paramedics, like many other first responders or frontline workers, provide absolutely critical services, and that has never been in question.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Hi, good afternoon. Picking up on the vaccine question, given some of the pretty severe outbreaks we've seen in prisons and jails, just wondering how high a priority inmates should be in receiving the vaccine, and also whether there's anything more that your office can do within your power to really try to get those outbreaks within corrections facilities under control.
It's an important point that anyone who lives in a setting where what we might term a congregate setting, where there are lots of people living in close proximity to each other, there is a high risk of spread in all of those types of settings, and correctional facilities are just one example. That is part, again, there's multiple factors to consider when we're looking at phase 2. But again, those decisions have not yet been made, and they will be, of course, challenging. And as I mentioned, we'll have a clear ethical dimension that we need to make sure we're considering. With respect to the outbreaks, I did just meet last week with representatives with people from my team, as well as representatives from Justice and Solicitor General, to talk through how we can best support the work that's being done. And I will say that the work that has been done by the correctional institutions in the province has been very strong at preventing introductions for the most part. Unfortunately, when you have many people living together, and we see this again in long-term care and supportive living, when an introduction of the virus happens without identification, unfortunately it can spread extremely quickly, and that's very challenging. So we are looking at what are all the possible ways that we might be able to improve the response, but I will say that overall, again, the protocols have been effective, but unfortunately with our current very high level of community transmission, it becomes difficult to prevent all introductions into all of these settings, which includes long-term care, correctional facilities, schools, the list goes on, where introductions will increase as our community transmission rises.
Operator, could you please put through the second last question?
Yes, next question is Tomasia De Silva with Global TV. Go ahead, Tomasia.
Hi there, Dr. Hinshaw. I'm just actually going back to the UK variant. Can you let us know is it demanded that those people who have been out of or who have traveled from the UK be tested, or is it just recommended? As well, what about those who are coming via another European city but from the UK? And one more, is there a possibility that we would have to stop the pilot program, the international pilot program, in light of this new variant?
With respect to the first question, the testing is recommended, so individuals can decline, but we are strongly recommending that people who have come from the UK participate in testing, and the calls that will be made by AHS will be offering testing at a time that's convenient for that individual. The second question about who is included in that, we have been working with the Public Health Agency of Canada to be able to identify those who've come into the country and ended up in Alberta, who've spent time in the UK, whether or not that was where they flew from. And so we're working with them to try to identify what records they have and to be able to contact all those who have been in the UK within the last 14 days. The final question about the border pilot, at this time, we are not contemplating stopping the pilot. This is specifically at this point in time focused on individuals who've been in the UK for the last 14 days. I want to emphasize that right now this is a precautionary measure as we look to understand more about this variant and what it means. You may recall that in the summer there was identification of a variant, and some similar questions were coming up about transmissibility and severity. Over time, it turned out in that particular case that those hypotheses were not correct. In this particular case, again, there is some evidence enough that we think we need to be cautious, but we do need to wait for more evidence to be available before making some final decisions.
Operator, could you put through the final question, please?
Final question is Robert Tuttle, Bloomberg News. Go ahead, Robert.
Yes, hi, Dr. Henshaw. There's been, it seems like a growing outbreak up in the north in the oil production region, and particularly the oil sands, just based on the list you guys published. I'm just wondering, with these people who are discovered at the sites in these remote areas, how are you advising companies to get these people either home, or do they have to stay at the site? I mean, presumably they can't fly, right? I mean, how do you get these people safely to their homes so they can isolate?
We have been working closely for many months since the beginning of the pandemic with companies that have work sites in the north and other similar kinds of companies that have, again, work sites that, and I'll distinguish between the work site where people may come in and out and the work camps where people live while they are in that remote area. So there's been a lot of work done to make sure that the regular everyday protocols are robust to prevent widespread transmission. When a case is identified, then there's additional measures that go into place. And people who are identified as a case of COVID-19, we have been working again with the companies to make sure there are protocols if those individuals can safely drive themselves to their own residence and they're not going to be potentially exposing someone at high risk, then that is something that is permitted to happen. They also, if they can't do that, there's been a lot of work with the companies to make arrangements for them to have safe isolation spaces to complete that period of time during which they're infectious. And again, I just want to note the work that's gone into this, both from the individuals on my team who've been involved, as well as those companies, to put those processes in place. But again, going back to an earlier point, when we have widespread community transmission, the likelihood of an introduction goes up, and it becomes more challenging to keep the virus out of any setting. And so again, that's the work that we're all collectively engaged in to bring our transmission down with the measures that are currently in place.
Thank you all for joining us. Dr. Henshaw will provide another update tomorrow afternoon. Have a safe night.